several months on multiple vaccine trials, including the vaccine trial from the Moderna COVID-19 vaccine and this new Janssen or Johnson Johnson COVID-19 vaccine. And our trial work for Janssen began back in November. And so we're very excited to now be able to hear the results discussed publicly by the FDA committee. One of the great things about this vaccine is that it is one dose, and in the phase 3 trial that we have completed, and that will be ongoing likely for the next foreseeable weeks, we see that this vaccine is very effective in preventing moderate to severe disease. Overall in the United States, 72% efficacy. And then when we talk about more severe disease, 86% efficacy. And then in preventing deaths and hospitalizations, we're really talking much higher at 100%. There's also some evidence from the vaccine trial work done because they enrolled individuals in South Africa that the vaccine has efficacy against the strain circulating originally from South Africa, but now spread to several countries and is now here in the United States as well. The other thing that I think is really important to know about the trial itself is that when we have been conducting the trial, it enrolled a very diverse participant population. That includes diversity through racial ethnic groups, including African Americans. And in our trial site, actually here in Detroit, we enrolled a very high proportion relative to the overall population for African Americans. And also, you can know that the trial was done in younger adults, older adults, so we can demonstrate now efficacy of this vaccine in both young and older age groups, which is very, very important as we roll out potentially a third vaccine for COVID-19. So today, what it looks like, depending on what the final vote is for the FDA committee, that this vaccine could be approved through the emergency use authorization process at the FDA. So this is very good news potentially for the United States and other countries as well in the control efforts for COVID-19. And so one of the things I think that's really important also to note about this vaccine is that it can be stored at normal refrigerator temperatures. So the storage conditions are very favorable for widespread dissemination or distribution throughout Michigan, throughout Detroit, and the United States in general. And as we go forward with this vaccine trial, and as we look forward to potential EUA or likely EUA emergency use authorization, we can also know that we're going to be tracking very, very carefully vaccine safety and continued effectiveness of the vaccine throughout the United States. And so we'll learn more and more about this vaccine as we go forward in the coming months. And so I'd like to turn the microphone over to Dr. Mossallam for further comments and to discuss the Henry Ford Health System vaccination efforts. Thank you.
Hi, thank you, Dr. Kilgore. Appreciate that. Exciting news indeed. So I wanted to really begin by providing an update on Henry Ford Health System's vaccination efforts. By the end of today, the 26th of February, we will have Henry Ford Health System will have administered more than 124,000 doses of the vaccine and fully vaccinated approximately 53,000 people. This represents 1 out of every 20 Michiganders who have been vaccinated to date. So that's a really exciting figure that we've been able to contribute a little over 5% of Michigan's total vaccination effort thus far. We could have done more. Vaccine supply has been the issue so far. For the coming week, we expect about 7,000 first doses of vaccine, both Pfizer and Moderna, and we actually have scheduled a little over 5,000 people to receive their second doses. Statewide, the state of Michigan is expecting 160,000 first doses to be distributed, both the Moderna and Pfizer vaccine. And if Johnson Johnson actually does get their EUA approval this weekend, the state expects about an additional 83,000 doses of Johnson Johnson. How that will be distributed is unclear at this stage. The allocations to the state does not include commercial pharmacies and other federally funded and supplied vaccination programs. I think it's really exciting that Johnson Johnson is coming. This will be a third vaccine to continue to fight against the pandemic. Johnson Johnson has stated that they will have about 4 million doses that they expect to distribute immediately upon approval. And as I said, 83,000 is what the state of Michigan expects to have, and then ongoing for the next few weeks, a little bit less than that, I think they said. But this does pose or suggest that this is essentially about a 50% increase of vaccine supply to the state, and we hope that will actually be the same for an allocation perspective to Henry Ford Health System. If you think about sort of what the recent notifications are from all of these distributors, Johnson & Johnson said that they will be able to provide about 20 million additional doses by April. Pfizer and Moderna are promising a combined increase of 140 million more doses. And so between the three, that's essentially an additional 90 million people that could be vaccinated by April 1st. Twice as many as has been vaccinated thus far. So this is really exciting news that we will get well on our way to vaccinating more and more people to try to get to that magic herd immunity figure that we are all talking about and or have heard about. When you think about Henry Ford Health System right now, as I've just alluded to, we're scheduled to deliver about 12,000 doses next week. We have the capacity and are set up to deliver more than 25,000 shots each week. That's 2.5 times the number we're providing this week. Again, it's all based on vaccine supply. And we're very proud of the efforts of all of our team members in working really hard to set this up to get as many people vaccinated as possible. We have been very active in partnering with health departments, community organizations, and others and try to help them to give them resources to administer vaccines to minority underserved populations. A big focus for us is trying to reach vulnerable populations, people of color. Among these is the Senior Saturdays program that many of you may have heard about at Second Ebenezer Church, and that's in a partnership with the city of Detroit, where we are vaccinating about 500 senior African Americans at that church every Saturday. This is planned for 4 Saturdays with Moderna vaccine to come back again for another 4 for that second dose. So that's a little over 2,000, mostly minority members of our community that we will have vaccinated by the end of that effort. We have assisted and have worked with the city of Detroit and others to have vaccinated well over 1,000 Border Patrol agents and other Department of Homeland Security folks. We have helped to vaccinate Detroit EMS, fire, and police to the tune of another 1,000 or more individuals. Our mobile unit, our GHI Global Health Initiative mobile team is working very closely with communities in Jackson, in Detroit, Dearborn, Macomb, and Oak Park to set up similar programs such as the Second Ebenezer Church. In fact, we are in a underserved community in Macomb today, vaccinating well over 200 teachers at that site. We have several vans that we've been able to purchase through grant funding from the state of Michigan, the CARES Act fund, and a grant from Johnson & Johnson to be able to take these mobile units and bring vaccine to where it is most in need. As we understand and respect, many of our community members have concerns and or trust issues. Many of them have the inability to travel. And so we are working very hard to go where the need is greatest and where our patients and our community members are to get them vaccinated. I think really what I wanted to conclude by saying is the Henry Ford Health System has been and continues to be a proud leader in combating this pandemic. We have been very fortunate and have been able to provide critical phase 3 data for both Moderna and Johnson & Johnson, the trials. We are currently continuing in the two-shot regimen of the Johnson & Johnson vaccine that Dr. Kilgore and others from Henry Ford Health System are PIs for, primary investigators. And we continue that work, and we're very proud of the work in delivering vaccines where it's most needed, and a whole host of other treatments and trials. So it has been a great effort, and we are privileged and very fortunate to have been a part of all of these efforts to contribute to ending this pandemic. With that, Dr. Kilgore and I are happy to take questions.
Thank you, Dr. Mossallam. And everybody, if you could go ahead and either raise your hand or put your question in the chat for us, I'll go ahead and call on you in the order in which I see those questions to the best of my ability. I will also just let you know, as an FYI, we do have a hard out of 2 o'clock today. So generally we do fine in terms of having enough time for question and answers, but I just don't want anybody to be surprised. Okay, I'm going to actually go ahead and get us started. So Dr. Kilgore and Dr. Mossallam, how is the enrollment in the J&J second enrollment or second study going? And how do you think that that has been sort of informed or influenced by the information that we have about the efficacy of the one-dose vaccine?
Right, so I can take that question. So a couple of things. One is that the enrollment is progressing very, very well. In fact, the enrollment target is almost complete. I expect that we will probably finish enrollment in the 2-dose vaccine trial sometime next week or maybe the following week early. So that's very good news. And it's a global study as well, global trial, and which means we're going to have data for the 2-dose regimen in the United States and other countries. And one of the nice things about this is that we're going to be able to add the information from this trial to the other information we already have from the 1-dose trial. And future decisions will be made by the FDA and the VRBPAC committee regarding the use of the 2-dose regimen. But I'm very optimistic we'll finish that enrollment very soon.
Very good, thank you. And another question I wanted to follow up with you on was, you mentioned the high proportion of minorities in our original study relative to the population. Can you expand on that a little bit more and give us like a better idea of just how we overperformed it as a community?
Right. So at the national level, for example, African Americans are represented in a range of about 13%. And of course, it varies widely depending on the overall geographic area where you're talking about. And our enrollment is for African Americans is approximately double that. One of the implications of that enrollment is that when we look at the data analysis, we now can be confident that when we look at safety of the vaccine, number one, and number two, when we look at efficacy for the vaccine, we can be now confident that this vaccine, in particular the Janssen vaccine, is safe and effective in minority populations, particularly African Americans and other racial ethnic groups as well.
On that subject, Dr. Mossallam, we also were very prolific in our enrollment of the Moderna trial in terms of the African American community. How do you see that effect as you go out into the community as part of these Senior Saturdays events? Has that sort of helped with the vaccine hesitancy issue?
So yeah, thank you. I was going to actually mention that we did very well as well in the Moderna vaccine trial in enrolling people of color and older individuals. And so that absolutely does give us the confidence when we go about and help to educate. And as a matter of fact, the system, Dr. Kilgore has been in many, put on well over 120 seminars and webinars and educational series. And so that we can speak with confidence about the science, and the science includes a diverse population. And it's not just a very discrete patient population, and then you're sort of just trying to, make an inference. But this is very specific, and it helps us with confidence to speak to the science, and that it is actually the trial volunteers represent the community we're addressing.
Very good. Thank you, Dr. Mossallam. And again, anybody, if you have any questions, go ahead and raise your hand or put them in the chat for me. If you don't have any questions, we'll go ahead and let everybody get back to their very busy afternoons, or possibly start their weekends early. But I think, gentlemen, just parting thoughts as we continue to wait for the emergency use authorization, presuming that we're going to get them. I would imagine this is a very exciting time for you both, personally and professionally, as we just continue to see work towards getting to the end of this pandemic and getting folks vaccinated.
It is, Dana, and thank you very much, because one of the things I wanted to leave listeners with is a very important message, and that is, if this new vaccine is approved and recommended by the committee and the FDA, and you have an opportunity to get either a Pfizer vaccine, Moderna vaccine, or the Janssen or J&J vaccine, I would highly recommend that you take advantage of that opportunity. Each of these vaccines are safe and effective. Personally, I would feel very comfortable receiving any one of them, and that would be very important in order for us to control COVID-19, but also achieve that herd immunity, herd protection that we really desperately need in the country to really stop the pandemic in its tracks.
And one more thing I do think we should highlight before we go, folks, is Dr. Mossallam, maybe you could take this one for us. You know, I have heard folks say, and questions come up in our vaccine hesitancy efforts, that, you know, maybe some people will wait for just the 1-dose vaccine because maybe that's better than a 2-dose vaccine. What can you tell us about that? And what would you like the public to keep in mind?
It really is to reaffirm Dr. Kilgore's message, right? Right now, so vaccine shopping is something that you're sort of alluding to. We would absolutely recommend, without any hesitancy, with complete confidence, that you take whichever vaccine is offered to you. They have all been shown to be highly efficacious. The Johnson Johnson, the Janssen vaccine is essentially 100% effective at keeping people from severe illness and or death. So whichever is afforded to you, please take it. Logistics are logistics, and if people have reasons for whatever, but I think one of the key things that we at this time do not have enough vaccine across the entire country to be able to offer people a choice. And so my recommendation to my patients and my family members and to my friends and colleagues is take the vaccine that's offered. You will have the protection that you need. And as a group, we will all do our part to end this pandemic.
Excellent. Thank you so much, Dr. Kilgore, Dr. Mossallam. Thank you for your time this afternoon. And everybody, thanks for joining us as well. And we'll see you on the next one. Have a great weekend.
Thank you very much.
Thank you, everybody.